So I want to introduce my partner, Trusha Shah, who is a neuro-oncologist who joins us from the University of Washington, where we trained together. I've known her for a while and was thrilled to be able to entice her to come and join us at Swedish, and have convinced her to talk to you about seizures today, because I know this is a topic that many of our patients deal with, and I always get the question, well, what is a seizure? What does it mean? And so I thought, what a great, topic for us to review, kind of some nice basic neurology. So thank you.
Introduction. So yeah, I'm going to be talking about seizures. So I like to have objectives for any talk that I give. So really the goal for this talk is to define what a seizure is, explain how different seizures can present, describe some triggers for seizures, some safety information for patients and families, and precautions to take after having a seizure. So what is a seizure? A seizure is caused by a sudden, uncontrolled electrical disturbance in the brain. So our brain, just like our heart, has a normal electrical rhythm that it follows. You can think of your brain as a computer. A seizure represents a computer glitch secondary to a power surge, just kind of malfunctions. And so who is at risk for seizures? Anyone with any sort of injury to the brain. So if you've had any history of brain surgery, that puts you at risk for seizures, a stroke, a brain infection, a traumatic brain injury. Some people are born with abnormalities in the structure of their brain that can predispose them to seizures. Certain genetic syndromes predispose people to seizures. And really what I say is anything that takes up space in the brain puts people at risk for seizures. So brain tumors, for example. What happens in a seizure? So when the wave of abnormal electrical activity happens, the symptoms you have will depend on where in the brain the seizures occur. As you guys may know, the brain is all about location, location, location. And first I want to describe focal seizures. So focal seizures are seizures that are confined to one side of the brain. They can cause twitching, tingling, shaking on one side of the body. Sometimes the symptoms can appear similar to a stroke. So you can get weakness on one side, you can get face drooping. It's pretty scary to see. However, focal seizures can manifest, I say, in a million different ways, and sometimes it's hard to know what's a focal seizure versus something else. They can manifest as difficulty speaking. They can be with or without loss of consciousness. Temporal lobe seizures in particular can present very differently than what people think of in your classic seizure. I always tell people the temporal lobe is what we call the most epileptogenic part of the brain. Really, any sort of injury to the temporal lobe can increase your risk for seizures. But temporal lobe seizures present differently. They can present with these deja vu sensations, which patients ask, well, how do I know if I have a deja vu sensation? And I'm like, it's hard to describe, but you kind of just know, this feeling happening of like, wait, that just happened. Even abnormal smells. Again, you wouldn't think of like an abnormal smell to be a seizure, but if you start to get symptoms where you're like, I think I'm smelling something burning or something like that, that's just not there, that can be concerning for a focal seizure. Generalized tonic-clonic seizures are what I want to talk about next. These are grand mal seizures. These are probably what you typically think of when you think of seizures. And these happen when the abnormal electrical signal involves both sides of the brain. So in brain tumor patients, usually the seizure starts focally. It starts in the area where the brain tumor is, where the surgery is, and then if it spreads to the other side of the brain, then it becomes a generalized tonic-clonic seizure. This involves full body shaking, and people 100% of the time will lose consciousness. And these are the more dangerous types of seizures. While focal seizures are worrisome, them in and of itself are not concerning because as long as you're still breathing and things like that. However, generalized tonic-clonic seizures can become a medical emergency, because your breathing can be affected, and if it's prolonged, it can affect oxygen delivery to the brain. So what should family members do during a generalized tonic-clonic seizure? The first thing is always said is just stay calm and stay with the person seizing. Remove all sharp or dangerous objects around the person seizing. Place them on their side to keep their airway clear. Loosen any tight clothing, whether that's a collar, a tie, things like that. If you have a rescue medication, which some of you may have at home, give them med if you can do so safely. However, nothing else should be in the mouth at this time. No other food or drink while someone is having a generalized tonic-clonic seizure. If a generalized tonic-clonic seizure has not stopped within a few minutes, call 911. I will say watching someone seize for a couple minutes feels like a lifetime. So it is A lot of times people just call 911 right away, and it's a very scary thing to watch if you've never seen it before. And it's considered status epilepticus if the seizure has not stopped within 5 minutes, and that is a medical emergency. So what I always say is, it takes a few minutes for the paramedics to arrive. So if a seizure has not stopped within a minute or two, definitely consider calling 911, especially if you don't have any rescue meds at home. So what triggers seizures? Really any sort of additional stress on the body or the brain. So infection and especially fevers can trigger seizures. Lack of sleep, lab abnormalities such as low glucose or low sodium, and increased tumor size and swelling can also trigger seizures. Emotional stress can contribute. Flashing lights are a notorious trigger for seizures, so be careful if you're a regular concert attendee. Drugs and excessive alcohol use can trigger seizures. However, sometimes there's no identifiable trigger. You'll just be kind of living your normal life, eating well, sleeping well, doing everything normally, and suddenly you'll have a seizure. So how to prevent seizures? 1, take your seizure medications and do not miss doses. It's always good to take them around the same time every day. Make sure you're getting enough sleep. If you have a fever, take Tylenol or another agent that can lower your fever, because again, fevers are a very big risk factor for developing a breakthrough seizure. Tell your neuro-oncologist or whoever's managing your seizures whenever you have a seizure so your medications can be adjusted accordingly. If you have a very clear trigger, if you're like, I missed my medication dose or I just didn't sleep the night before, I had so much stress, oftentimes we won't necessarily change your medication dosing, but especially the times if you've just had no identifiable trigger, then we need to adjust your meds accordingly. Things to watch out for. So again, cold and flu season, so similar to now, can increase risk for seizures. You're at high risk for getting infections this time of year. Traveling. I always tell patients, when you're traveling, make sure you watch out for when you're taking your meds and things like that. Because let's say you're traveling somewhere that has a 6-hour time difference, make sure you continue to take your meds at the same intervals that you were before. So whatever that is, 12 hours, it's not gonna be the same timing exactly. And keep in mind that when you're on flights and things like that, it's really hard to sleep. So just keep an extra caution when you're traveling. Other considerations, make sure you tell your neuro-oncologist about all the medications and supplements you are taking, as there can be drug-drug interactions, and that supplements that you're taking that are prescribed, not prescribed, even hormonal contraceptive medications, please tell your neuro-oncologist, because again, there can be some interactions that we need to know about. Seizures in pregnancy. So if you're planning on becoming pregnant, discuss this with your provider, whoever is managing your seizures, as pregnant patients with seizures need to be watched much more closely. There's only a few seizure medications that are regarded as being safe in pregnancy, and those two are levetiracetam and lamotrigine. Ideally, we would like your seizures to be well controlled before becoming pregnant. What I've heard in general is that we would like you to be seizure-free for 9 months, so essentially the duration of a pregnancy before becoming pregnant, to assure the biggest chance for success while you are pregnant and not having seizures. And we would likely refer you to an epilepsy specialist if you haven't seen one already, just because it can get incredibly complicated to manage your seizure medications while someone is pregnant, especially lamotrigine. The levels can very much fluctuate just depending on what trimester you're in. So some questions that we get a lot: should you be on a seizure medication if you have never had a seizure? The short answer is no. You may be on it short term after surgery, but there is no evidence for long-term use of what we call prophylactic seizure medication. So definitely let us know if you've just continued your Keppra or whatever medication long-term. You don't need to be on it. And other questions that we get are, how long do I need to be on seizure medication? It really varies from person to person. Oftentimes, what I tell patients is that you'll be on it for the foreseeable future, and many times you need to be on it long term, as there is an inherent risk of having seizures with a brain tumor. This is a tumor that's undergone surgery, chemotherapy, radiation. Those are all risk factors for having seizures. And eventually, if you're like, I haven't had a seizure in 5 years, can I come off my seizure medication? It's always a risk-benefit discussion, because it could be that you haven't had a seizure because you've been well controlled on the medications you're on, or just your threshold is a lot higher for having seizures, and you may be okay off of medication. But there's always an inherent risk. So I always talk to my patients and say, if you are okay with taking that risk, and remember, there's a lot of consequences that happen if you do have a seizure, which I'll get into. So as long as you're okay with potentially having a seizure, we can start to taper down your medications. And we generally like to do that in a slow, stepwise fashion to make sure if you do have a breakthrough seizure, that we catch it while it's a focal seizure and it's not one big major seizure. The seizure precautions. So most importantly, Washington state law says that you cannot drive for 6 months after a seizure that would impair your ability to drive. This is probably one of the more difficult things that I have to tell patients after a seizure, and I know it's not fun to hear, but it's really, as you can understand, for your safety, the safety of others. If you were in a car and you had a loved one in the car and were driving and had a seizure, just imagine what could happen. You could hurt yourself, hurt your loved one, and also hurt other people. What I always tell patients as well is that if you were driving and you were to get into an accident, and even if it was 100% the other person's fault, if that went to court and they saw that you were not supposed to be driving because you had a seizure, it would automatically be your fault. So keep that in mind. Other considerations: be careful around hot stoves, do not take baths, do not climb tall ladders, and install appropriate equipment in the shower, such as non-slip mats and things like that. If you're swimming, make sure there is supervision. And depending on your profession and line of work, you may need special precautions, specifically no operating heavy machinery after at least 6 months after a seizure. Further seizure precautions. So tell your friends and family that you have a history of seizures, so they are ready to act if one happens, and just give them some instructions of like, hey, this is what you should do if I do have a seizure. Consider getting a medical alert bracelet, especially if you have frequent seizures. And that's about it. Any questions?
Does it work? Okay. Could you talk a little bit about if you have a rescue medication? And okay, that's number one. And number two, what's the usual protocol? Somebody has a seizure, it stops, it doesn't repeat, et cetera. Do you want a my chart message? Do what's kind of, how do we follow up, or what's usual?
Yeah, great question. So for the rescue medications, I prefer the intranasal route, because obviously if someone's seizing, it can be very difficult to get something in their mouth. Unfortunately, it is very difficult to get that medication. I have not successfully seen a patient recently get it. It's called intranasal midazolam. It's used a lot in the pediatric world, but in the adult world, insurances just don't cover it. So what we do instead is we give a small tablet that we say just like crush and put in the mouth, put under the tongue. If you can safely do it, again, if you don't feel like someone can safely swallow it, there's big risk there of it going down the wrong tube, and people can choke and get aspiration pneumonia and things like that. So, but if you can safely give it, I would say give it. And some people know, again, a lot of times brain tumor patients their seizures will start with an aura. It's kind of like a warning sign of, I'm going to have a seizure, let me just take this now. And a lot of people take it then to avoid it going into a generalized tonic-clonic seizure. Some patients, however, don't really have much of a warning, and they will just full on go into a generalized tonic-clonic seizure. And I would say at that point, you can give your rescue medication, or someone can give it to you at the start of a seizure. And I would say wait 5 minutes. And again, 5 minutes is a long time when you're watching someone seize. And if it doesn't stop, give it again. And these are 2 milligram tablets of Ativan. There's other medications we use, but most of the time it's Ativan. But you cannot give anything more than that, because after that, it can affect your breathing. And so if it's not stopping after the second dose, then you definitely need to call 911.
The protocol for the clinics in general?
Yeah, I would say we like to know more than not know. I know Dr. Bonham's the same way. So yes, feel free to my chart and say, hey, I had a seizure. We usually, do visits the same week, if not, very soon after. If you're like, I had a seizure, but I forgot my last 3 doses, I was traveling, then that's one thing. But if it just came out of the blue, we would likely have a visit or have a discussion with you. You don't need to, like, it's an option, but I think some people, it's just everyone's different comfort levels. If you talk to some parents who have children with epilepsy, they're like, my kid sees this 18 times a day, and it's just, something that happens. So it just kind of depends on your comfort level. If you feel like you don't want to call 911, but, you don't want to deal with the emergency department, but you feel like you need some more additional assistance, absolutely call the on-call doc. I had a patient just today who told me she did it yesterday, so it's definitely an option.
Just as an aside, when my husband had his first seizure, we were driving home and he said, if you left me off here, I wouldn't know where I was. And 15 minutes later, we're home and he's fine. Do you know what I mean? But that was all. And then they told me afterwards that was the seizure. I didn't really recognize that.
Yeah, that's a great point. That's, kind of one of the points of this talk was seizures aren't always shaking, twitching, what you think of. They can present very differently in different people and different parts of the brain. And so anything that's off, just, alert us. It's our job to figure out, like, is this a seizure or not? But if anything that is abnormal, please let us know. Yes.
If I have a seizure, should I put the spoon in my mouth?
No, is that an old tale or something? Yeah, I've not heard that. Definitely nothing in the mouth other than a rescue medication if you have it. Anything else? All right, thank you, everyone.